and that you can't about vascular dementia. Now you can't vascular dementia. I see anything a cry. A dear back one, but say ye di etu ye hofo. I said, don't lose your head due to lack of blood. Don't lose your head. Don't lose your brain because of lack of blood. In fact, I know they introduce you to vascular dementia. No? Vascular. You can't vascular. I see any say. Aye intinia moja FM, that is a vascular no. And intinia moja FM eko ya adwene mu no. Saa intini no. Na aya na emu esi. Anti blood na moja eso eko wa adwene mu no. Na eso ate. Enti o brain cells no enya adwene ma hoden a ese onya. Na problems ediaba. Into vascular dementia no simply no declining. You can say declining bibia air buffum. Declining in thinking skills. Send no thinking skills caused by conditions that block. Conditions that a block and a reduce moja a flow to the various regions of your brain. O brain no divisions, different regions. Oh, now some moja anko all these regions now is deprived and that's nya edwanma hoden any oxygen now. And no any the vascular dementia no edeba. Into bo hu se senia odwene no senia o kaya de no bo se eba form na adwene a ebia untimi kra endwene enkwa akire first kra untimi dwene kwa akire utimi kai niema ba ebedu baby bo se ade nan say de me rate finiama pao na fe unti ase the beginning of vascular dementia and ye beko ayi afadese symptoms no kra. Internet is a general term and whether a describe a problem with reasoning, send out drink, planning, send out planning, judgment, send out to me judge bibi, ushese ayana and yet memory, and it just send out kaya defa and thought process, send ya utimi a journey caused by brain damage from impaired blood flow to your brain. Your brain no brain no 30% of moja nipaduane e produce ohia 30% nti ya adwene ni ehia moja papa nti when nya moja eno na bo se moja no so tika krapa na nipa esu ene omani so ebromo moja no so tika krapa na omo fenti moja no so tika krapa na chese omo nantia na omo kwafafa. It was a brain here, moja pa, nenos asotia ne kosu pa, na fe vascular dementia non so no, brain disorders no, na aba. Se yeti bibi ti se Alzheimer's. Yeti bibi ti se dementia. Yeti pa abrochimemo dementia ya dia ane Alzheimer's. Idea to say had juni pa to say governments no ebo papa. In fact, they say osha and no cry topo a car governments no ebo and intina care homes be brain adults no. A lot of people they have a lot of brain disorders a ye Alzheimer's no. Enyasam kitwa kra. In vascular dementia no. There are changes in thinking skills. Just say a hard unit. Sometimes, suddenly after a stroke, which can block major blood vessels, major blood vessels, it means intinia moja femuno, eko nipano nitimono, say bear 5 minutes. Na se moja no a block no, honomen bie pa. Nese stroke no aba. Na no after stroke no sanipa no he is never the same. Normally no obi kranya stroke. Sa my stroke ana yefe mini stroke. So onya eno ye kokoko. Eno no kire se intini mama moja femu no. Enuanom emu si ena clot to be block o ayi sa intini mama moja femu no aye ketwe bi ena clot to be she ho. Ena ebasa. Edu baby nso a moja ebia na unti me cry free ba moja eko tim no eso te suddenly eso te for about 5 minutes na moja eko wa dwene mu no eso te sa na 5 minutes a utimi enya a stroke nso. Inti saa time no obon se saa nipa no ebe start enya thinking difficulties na adwene se no odwene fa no ebe very serious na get worse senior okaya de fa no na get worse. Na etie for ade ne se nkofo bebre ewo de efre no invisible strokes no strokes a wankasa unhu doctor bianso unhu enso no unya invisible stroke a on feel say when you stroke it means say for a few minutes no moja ntimi enko wadwene mu enso na unim na unam ho fefefe any a friend invisible strokes no answer na yaba my stroke a nipa no eba utimi kasa utimi nante ba ebia na nanim baako aye dedenden na nano nso ebia obu ha na nano kracha na ne kasa asesa na ebia ne nante utimi nante ba ebia na togusu kakra eno ye my stroke ba ye afre bibi multiple stroke na multiple stroke ne de eba onipa no waka dem ana waka wheelchair mu na ye free bibi atrial fibrillation ne ya se ne se yakoma no unse yakoma no 4 chambers esro de 2 chambers and the form de nso another 2 chambers what form it was a form na esro de no 2 chambers no it say a bo in harmony with the down ones no na that chambers no na say e can chamber e ka say chamber ho e de enim sa but ye 2 chambers na esro and the form de nso so 2 chambers but I say omo bo in unison and in harmony. By a basse a srudia no ambo in harmony with a form dear now. I know that your friend atrial fibrillation a bassa muja a funny pedrinum a so te and no etimide vascular dementia a papa and also say obinya atrial fibrillation unswa utimi enya a clots sa atrial fibrillation a form of clots. Now clots is a bassa yamin pengu untimu enye freer. Na just a sim etinin intrimu no ko utima na e stroke no e de aba eyo ewo no so wo ho ene ye wo ye frɛ no ischemic stroke no eno nso so ane ye frɛ no and hemorrhage no I say bibi e pai intini bi timi pai ewo ni panitim hemorrhagic stroke. And it is ischemic stroke no and no say intime esia na clot aba na chese a block say ne men etimi ede vascular dementia no etimi ede ba into vascular dementia eya dia the second most common cause of dementia after Alzheimer's disease enyasem ketwa ekra into Alzheimer's disease no and a top pa. Now after that, no vascular dementia and a year number 2. I no. And yes, a bar, sending partners be a board man as unim baby or wo, there be. But the senior of Jennifer, untimin drinning a bio, untimin focus, untimin concentrate, not in the rate estative fear dear. A bassa untimin planet. Now one show ya through that no when ya Alzheimer's. I just unim baby or what, the only take no, untimin recognize no. Na boko no chese ono a chese ewiase a very sad type of disease adults or western countries ne papa na ye be symptoms no e den na be mo hu se sa nipa no enya vascular dementia ye the symptoms see ebeto platform is but before then no memfa number entuja na ebia wo yare bi na enya vascular dementia. But it will brain disorders bia she fre she ebia wuntimu si na obia na wunnim na unam ho fefefe entina ho na yare endi wo so anuanom ye krok da yare ye krokro no o krokro yare ekonanim eniti ana hame because me hu de hu ne kro na oho yiraw na owura orenso aho na ohuni ama ekoso ebia wo enef wo ho na bia sese wo reta finia ma antimi focus untimi plan na obi ne boawa boko no lead to Alzheimer's na the problems e dia ba me fa number ntudwa ebia na yare nkwa na wo diabetes e yare bone wo ayi blood pressure enye yare mpo eno mpo ye symptom ena bibi na de na ba wenya stroke da o nantia na okwa fanfa untimi da na jo wo insomnia wo anxiety wo depression or infertility problem or hepatitis kidney problem oda ayi dialysis cry. There's hope for you. There's no hope for you. Nyame adom. Number 0738. So outside the UK I +44 738 464 7300. Number bio +44 738 464 7300. Second number answer ye +44 745 988 9152. Now maybe you +44 745 988 9152. Inti obama joining ye no vascular dementia and ye kan wasem. Na yenka ho symptoms no bad then a wahu say war vascular dementia yi. The symptoms of vascular dementia no it depends on the part of the brain part of the brain are affected, and the severity of the symptoms. So the symptoms are very serious. It depends on how longer brain it has been without oxygen and blood. The strength of the symptoms depending on how longer part of the brain that region of the brain any oxygen. And now the severity na makan wasem no, and then the part of the brain also no, it also is very important. Now many symptoms it overlaps other type of dementia. It means symptoms other dementia also no, it mean enya similar symptoms. One show you which one is which. And na aya no be call hospital or by scan ahodwa because doctors in our hospital because symptoms no copy each other into no mu the cause now years and years still no na ye test scans blood test scans na yare so econonym. But the first symptoms no for a confusion and memory problem. Confusion. But nipa no ontimi concentrate no I confused na or start enya memory problem or kaya de first or kaya de but say ontimi kaya de papa. Sa nipa no so no the person has a trouble actually paying attention. Oni ontimi pay attention, ontimi focus, ontimi concentrate. Sa nipa no so bon say the person has a reduced ability to organize thoughts. Untimi organize, untimi plan it. Sani pano so untimi onya tese brofun say decline in ability to analyze. Untimi analyze the situation. Into untimi and communicating the plan with other people. Into sani pano so our difficulty deciding what to do next. We will be now na what to do next. Ebia wa bibi and so what to do next. Then it means that there's a problem. Sani panonso no obehun se waye restless and kakra na waye agitated na I say nebu afu ana say ayi say nebuti me fu na waye upset ana sad. Sani panonso no yes prophet you say unsteady gait and it means a loss of balance when walking. O ko wani man I say o ko wachi na ko afanfa into unni balance and also ewo ho. Sani panonso no bonse or sudden or frequent urge to urinate. Bonse kakra na junso edeno. Well lose ability to control passing urine. Into bonse junso dene kakra na wan kind no huwa. Bonse na or junso sebe egu no ho. Eno so ewo ho. All those infections of the bladder are now overactive bladder and so timi yesa. But sa odi no to nchen di ya. Na chese wan hwe ya na say it means o nerves say nipa ne nerves no affected because blood for nipadua nim no se eso tia nerves no, so that's the electrical part of the body no, so no a supply nipadua no ene pelvic area no, so no se weaker enti control eniama ujunso mu sani panso no kakra na why depressed na why sad na unhu ono ontiase de ntia why sad but you oba na owo menopause ma ano so betime ama why sad because of hormonal changes no enti sani panso no or starting ya trouble speaking ebo ha opese obo obi din but sani pani din no obi otimi boss side nipa ni din oba ya otimi boss side nipa ni din ye sani pa no so obi kan bibi nso a na ayese onte ase je we repeat sad na a few times answer na wate ase enti wo ho na chese obi kan bibi first obi kan bibi straight utimi dwen say we na all kan utimi pronounce edin no utimi kasa edin pronounce fefefe but say edin after that utimi pronounce bio enti wo ho nso na you find trouble finding the word upeso kan bibi but word ne ma emma upeso kai emma ewoma na aba eno so another symptoms any be enti entina ho na sa yare endidi wo so ekra because there is solution ebia na wuntinimu AC because of ebia wo diabetes omo diabetes no diabetes ade ba ko power diabetes ni say and pre-diabetes the so-called borderline no say esisi ntinimu 10 emra unhu inti dodo na timi enya diabetes no for years and years 20 years na esisi omuntinimu and not no munim ekra answer na ya diagnose or diabetes na omuntimi ni esisi through that no otimi enya vascular dementia. Inti say yanko types or stages of dementia. Stages no and the say stage 1 of dementia no impairment and I say or any pano no symptoms bia and only a stage 1 and but don't wait until say when your symptoms and we are stage 2 a questionable impairment. It means say patient no or best start some difficulty on speaking or remembering, but still no ultimate function, ultimate bibia or you're independent. Stage 3, sound no or mild impairment. It means najune no affect kakra, but still no just ultimate or your daily things, daily activities. Stage 4 no a friend of moderate impairment. Sound no stage 4 no of dementia no who say the patient needs help with caring for him or for her. Stage 4 no. Enti who say yare do bon say economy stages by stages. Stage 5 no your friend of moderate to severe impairment. Send pen hiamwa ontimi onu kwentiment na. Stage 6 no severe impairment. Sa nipa no ontimi and function. Ontimi enye independent. Stage 7, last stage, a very severe impairment, and only your body and mental function begin to fail. Ne body nankasa faili, ne mental faculties faili. A way and a chiro say yare develop, yare econonym, yare entena faku, o move echo forward. Into o crocra yarea. Na yare no so na nanim. Yen share causes of vascular dementia. Sena ye kano ne cause no den mainly ne intinima moja femuno and emu AC. Into emu sia ubre ne enya enough oxygen with that blood and energy ma hoden and the main cause. And I think so akomano so enye dwuma ya. Akomano bon tentem akoma bon tentem ana obi a palpitation or palpitation wakoma ntimi and supply mu onipadua no with enough blood into obi a palpitation biara or sa problem na it means say brain na onipadua no enya enough blood supply, but especially the brain enya enough blood supply. Omonso a omenya stroke da. And now say, if you catch wanya mini stroke no, sa nipa no so e chese ne ntiri mu nyina nye free. Ena ye wo ye friend of bibi say narrowed or chronic damaged brain blood vessel. Ayi think I directly a supply blood to the brain no. Ubon say I narrowed because of abia inflammation. I woni peduenum. Abia ne mu see but I inflamed into na akam wa eno so ewo ho. Ena nuanom se ne aka no diabetes. And also really the primary one of the main causes of power. Ye free be aneurysm. Aneurysm no ye say blood vessel na ana intine supply blood ewo unipe wadwunim no. Ana say intinum nankasa no ubon say emu aye kese. Na emu aye kese it means say emu timi huhuru ti say balloon no. Na enuanom say untima moja fam na emu timi huhuru say balloon na ewo tima etimi pai. Inti a paya and if a friend no hemorrhage no. Hemorrhage ayi stroke no. Inti ano so wo ho. Inti a very important say you take care. You take care of our blood vessels. And ya coma. You see nya good circulation. And you know why and betimi enya. Di obetimi enya no. Enya only say wo nyini o there be. Obia o in the 30s, 40s, 50s ni na obetimi enya. Hwe obi oba me ho be 20 years old na ne ntemu nyina esisi nti saa problem yi efe na atherosclerosis ntinu mu sisi first no na omo di 90 ni 80 ni na ya ta ha omo but sisi na aduane a yedi ene ye lifestyle ni nti no ubon se akola kra na ne ntinu mu esisi 17 years old 18 years old na ne ntinu mu kra statistics because odi fried meals enuane a ya cheche especially udi nnuane a ye di vegetable oil echichia and as a sunflower echichia asemato we ubenya constant inflammation now intima moja fe ne mu wawai na unipadua ne esisim enti na saade no tiase say na me ye young adena mintimu esisi na unimi say nnuane a ebia unye selective no na eno na de eba and obi a wanya history of heart attack no ana mini stroke eda no ono so sa nipa no so no ebetimi anya sa vascular dementia yi omo nso a omo wo high cholesterol but me ka say high cholesterol no there enye cholesterol wankasa u liver na produce no because the liver na produce 85% of our cholesterol needs 85 into 15% per any if ye aduane mi so didi ya. So when did ye no di unhealthy food na 15% na ebebe unipeduanum no. And no ede ye very unhealthy cholesterol no ebebe unipeduanum na ede problem ede aba. And na maka no obesity omo ye obese or be weight no more than necessary who say and no normally it invites and no invite diabetes and akoma yare and intrime musisi ebasakra wakoma eye dwuma too much and amaka say obi o atrial fibrillation no akoma yare no eno so etimi edeba nti we na risk factors a ewo ho nti anuanom ene ye hu say vascular dementia no etimi affect obiara in fact almost in the 30s even 20s kra no boko na started because started boko stage 1 stage 2 no e be started in the 20s and 30s na e bia sanipa no onim enti ebekọ nanim no on sanipa no obedi ebia in the ebia late 40s and 50s no na appear because there was 7 stages and there were nothing just happens everything start by stage enti na ehuhia say etimi ye boy ho ban enti and na madam asese tuning in for vascular dementia. We have been empowered through knowledge on vascular dementia. Nyame enhyira mo pa na mo fresh our number. Omo a omani beje ho for the English version or section no so no omo